So I am going to give a follow up on the patient that I saw who had the periorbital edema. She came back in 1 week later after I gave her the Decadron injection, and we continued the Benadryl, and the swelling had almost completely subsided. She may have still had a little puffiness around the eyes, but for the most part, it was 90% better than when she had come in, which leads me to believe that it was likely just an allergic reaction to medication versus cellulitis. She said the swelling went down maybe 2 days after I treated her, and she hadn't experienced any other symptoms. As you may recall, her labs were pretty normal. Um, she had recently been started on Keppra for new onset seizures, and she was adamant that she did not want to get off the Keppra because she didn't want to have any more seizures. So the Keppra remained. I did stop the clindamycin, and again, we just added some corticosteroids and the antihistamine. You will see the pictures that I have linked to this video, or that I have uploaded for this video, and it shows the different uh, kinds of swelling that you can experience to your face. Just thank God that she didn't go into anaphylactic shock. But on the first picture, you will see that's more angioedema. And there are certain medications that can cause the angioedema, like lisinopril. And this is the classic symptom right here, sign and symptom right here. The oversized lips, the red puffy lips. I see that a lot with people who have ACE inhibitor reactions, allergic reactions. And one thing that I find that a lot of people don't understand is that some patients can be on that medication for years and just one day just wake up and their lips are swollen. They can develop an allergic reaction overnight. So just because for those patients who've been on lisinopril for a while and they have never experienced the angioedema or the dry cough, nagging, hacky cough, that doesn't mean if they do develop it somewhere down the road while on that ACE inhibitor, that they still could have developed a reaction to that medication. So again, if you would notice, there are several pictures of the different types of just some general pictures of how your patient may come in when experiencing an allergic reaction, the different ways. There can be a varying degree of reactions. Some may just have a little puffiness to the face, to the eyes, to the lips. As far as the fair skinned patients, they could have the redness, the looking flushed, um, all the way to the full blown. Everything is swollen, all the way to the point of even their trachea and esophagus closing up. So just be mindful. Of course, we have to. Our main goal is to try to find the etiology, the what has caused that reaction. Um, but a lot of times, you may never find out what happened. I have a family member that actually experienced an anaphylactic reaction to an unknown pathogen. That was maybe 2 years ago. She had to be intubated for one day, and after they took her off the machines and basically sent her home with Benadryl, she went to an allergist. He did the testing, and they couldn't come to a conclusion about what exactly caused the reaction, allergic reaction, the angioedema, the anaphylaxis. And so now she will just have to be on Benadryl for the rest of her life. Um, and she has never had another incident like before. So just be mindful of that. When the patient first come in, there may be subtle symptoms that you're noticing, maybe a little itching, a little swelling, a little trace edema, itchy eyes. But those symptoms can progress and get worse in a matter of minutes. So don't pass it off lightly to think that you can treat them carefully and not make, look at that case as an urgent situation because things can rapidly change. A lot of the patients who we never are able to find out what happened to them will likely have to be prescribed EpiPens. Just so, and you have to reiterate with them and urge them to keep that EpiPen with them at all time because we do not know the culprit of the anaphylaxis. So once again, my patient came back in and she was 90% better. She was enthusiastic. She was very thankful because she was scared. She didn't know exactly what her condition was caused by. She didn't know if it was something in the home, something she had eaten, something that one of her family members or relatives um, had on them, or that she may have come into contact with. So she was very grateful and very thankful that her situation had subsided. So I just wanted to give you all an update about the patient who had the periorbital edema. I don't think it was cellulitis per se. It wasn't an inflammation or infection. But she had an allergic reaction to something. So thank you all to whoever watched my video and considered some of the possible etiologies of the reaction that she had. I ask that you comment, like, and subscribe. And I will see you all next time with the next case. Thank you.